20% growth. Now, when you compare it to Singapore, it's 0.7. No wonder Singaporeans are concerned about the growth of the population. So Pakistanis are a very productive people. So basically, Pakistan, the number of babies in 2011, they grew by 4.6 million, which is basically the size of the Singapore population. So Pakistan is adding Singapore every year to its population. It's the sixth most populous country in the world after China, India, US, Indonesia, and Brazil. And the area is equivalent to the total combined area of France and the United Kingdom. Although Punjab is the most populous province, Balochistan is the largest as far as area is concerned, and with a lot of natural resources which have yet to be tapped. It's a young population, and almost 47% are below the age of 19, and almost 18% of the total population lives in 10 cities, with Karachi being the largest. The total pharmaceutical market is almost $2 billion, growing in value about 17.6%. And if you notice that of the top 10 companies, 6 are multinationals. Getz, Sami, Hilton, and CERN are 100% Pakistani companies. The multinationals in the top 10 amount to almost 80% of this, or 52% of this business. 10 companies control 52% of the pharmaceutical market in Pakistan. And the multinationals have almost 80% of that. You may be wondering, why is there a disparity between units and in value? The difference is product mix and price. How are we compared to the global market? The global pharmaceutical industry is about 950 billion, growing at only 2.5%. And the largest growth is coming from Asia, Africa, Australia at 14%. Japan, which is the second largest market in the world after US, there's hardly any growth as far as the pharmaceutical sector is concerned. Some of the other countries in Asia, you can see the growth. India, the domestic market in India is about 11 billion, and they are growing at about 20%. But India has exports almost of the same number, about 11 billion. So India is exporting a lot of pharmaceuticals. Pakistan's exports are only about 400 million. So when you look at the growth rates, Pakistan growth at 17% is pretty good. In fact, it's the fastest growing among all these small countries in Asia. Per capita consumption of pharmaceuticals, Pakistan has one of the lowest in the world at $11.4 per capita. Singapore has 142. When you look at the multinationals and the locals are growing very, very fast. Because at the moment, half the market of 2 billion is controlled by the local companies, and the multinationals are half. But at the time of partition in 1947, almost 90% was foreign. And today, the local industry and the foreign, they account for almost 85% of the pharmaceutical market. The rest of 15% import. So the locals have done pretty well. As you've noticed in the top 10, 4 are local companies. If you look at the unit growth, they're doing well, and also in value. Now you may ask why it is. I think it's a matter of ethical practices. Because foreign companies, they have their own code of conduct, they follow that, and particularly the American companies, they have this sort of Damocles hanging called the Foreign Corrupt Practice Act. The top 10 therapeutic classes, that is, in the pharma industry, we classify different areas like antibiotics. Now in Pakistan, 21% of the market is systemic antibiotics, antibacterials. But this is typical of a developing market or a developing country. Whereas if you were to look at a Western country like US or Europe, the biggest sector would be cardiovasculars. And when you look at the growths in this sector, for instance, when you look at antibiotics growing at 15.7%, look at antacids growing at 22.5%, they're pretty good growths, but they're typical of a developing economy. Secondly, we do not touch more than 30% of the total population. When you talk of pharmaceuticals, majority of the people who live in the rural areas, they are not touched by allopathic medicine. Either because there are no doctors or there are no dispensaries. And secondly, also is a question of economic power. They do not have the purchasing power. Yeah, that's it. Thank you. The top 10 leading products in Pakistan are Augmentin, which is an antibiotic. It's the largest selling product in Pakistan. Followed by interferon, and that is for the management of hepatitis, which is also very rampant. Brufen is a pain reliever. Velocif is a cephalosporin. So you will notice there's no in the top 10, there is no cardiovascular product. Approximately $2 billion industry, classified as an essential industry which has a well-developed manufacturing infrastructure. It has a significant export potential, but because of the regulatory environment, it's very difficult to operate. McKinsey has identified Pakistan as a industry, the pharmaceutical industry in Pakistan as a export with a lot of export potential. But the environment in which we operate, it's very difficult. The pharma industry provides direct and indirect employment to over 4 million skilled workers. And the industry is the largest employer of university graduates in semi-urban and rural areas. This is because we use medical reps. And although they go to colleges and universities in major towns, some of them want to come back and live in their own, rural areas. So we can offer them employment because we can use them to promote our products in that particular territory. A lot of them, there's a big migration from rural to urban areas, and therefore some of the people who go and study, they don't want to go back. And this industry is also helping to develop talent, because whether it's management talent, whether it's sales or marketing or manufacturing, it does help to build up the talent of various people. So in management development, it's playing a very critical part. Now let me show you a slide, the last slide which I have here. which talks about the history of pharmaceutical regulation in Pakistan. In 1972, when late Mr. Bhutto came to power, he had a leftist health minister by the name of Shaikh Rashid, who thought that by bringing a generic act, which meant that there would be no brand names, only generic names, the entire pharma industry had to convert, so we started selling pharmaceutical products under generic names, like vitamin C, vitamin B, erythromycin, no brand names. And his thought was that local industry will grow, because at that time, the multinational had almost 70% of the pharma market. Well, we told them that this is not going to work, because Pakistan did not have the necessary infrastructure to control the quality of drugs in the country. But anyway, the law was passed, but the doctors, they were conscious, and they started writing the name of the company after the name of the compound. Like they would say, vitamin B, Pfizer, or penicillin, SmithKline, and so on and so forth. So the foreign company got the boost here, because the local companies could not compete. Because at that time there was no price control. Since this scheme didn't work out, it was an absolute disaster. So in 1976, during Mr. Bhutto's time, this act was, the Drug Generic Act was repealed, and a Drugs Act in 1976 was passed. But with that, brand names were allowed, but there was a price control imposed on every drug. Now in India, there is price control, but there are only about 70 drugs, 70 compounds which are necessary that there is a price control. For the other products which are not essential, there is no price control. So we operate under severe price constraints. That's why our prices are very, very low. The prices of pharmaceuticals in India and Pakistan are very low. I'll give you an example, like a ciprofloxacin, which is antibacterial, a pretty powerful one, and commonly used by doctors. It sells in Pakistan at about 70 cents US dollar equivalent. But if you were to buy the drug here in Singapore, you would have to pay $9. The question comes up, and a lot of people have asked me, that is the quality of the pharmaceuticals manufactured in Pakistan, is it as good as made in US or Europe? And my answer is yes, provided you buy the pharmaceutical manufactured by an international reputable company. Because no company will play around with its brand. Because the important thing is our brand, and we will not forsake it. So let me repeat. No problem in buying a drug manufactured in India or Pakistan, which is made by an internationally well-known company. Because our quality standards are exactly the same. We have the same specification for the drug, and we have the same quality control standards and the same testing specifications. So there's no doubt, and should be no doubt. It's basically psychosomatic, because sometimes people think because I bought it from UK or US, and it does work, because sometimes when you do clinical trials, even the placebo works. So it's a matter of psychology. But I can assure you that there's no difference in the product itself. The batch sizes may vary, the equipment may vary, but the drug basically is the same. There should be no difference. In 2000, because this price control in 2000 was the last across the board price increase granted by the Ministry of Health. Now remember, the Pakistani rupee has been devalued. So our costs, because in India, almost 90% of the basic drugs are manufactured in India. In Pakistan, we have to import almost 80% of the raw material. There's a big difference, because India, first of all, is a bigger market, but it encouraged the development of the local basic fine chemical industry. Unfortunately, Pakistan did not. Even today, you can register a drug for import. The only problem is the pricing, because if you import a drug, and you'll get registration, because every drug has to be registered in the country. The only problem is that markup, the government allows on imported drugs only 45%. But that's easy to go around that, because if you up your billing price, you'll get a 45% markup on that. As far as domestic pricing is concerned, there's no system. It's ad hoc. You make representations to the government, they may or they may not listen to you. But at the moment, what has happened is that in 2011, with the 18th Amendment, which was the amendment which did away with all the powers that the president was curtailed. There were a lot of things in this 18th Amendment. But before that, health, the subject of health was on concurrent list, both provincial and central. But because the provinces wanted greater control over the health facilities, that is the hospitals in the provinces, some of them are run by the central government, they gave away, through an act of the National Assembly, health became a provincial subject. And I don't know whether the authorities were aware of it or not, but they didn't realize by moving health and abolishing the Ministry of Health, pharmaceuticals were left in limbo. Because the provinces did not have the necessary resources to control, to manage, to approve drugs, and monitor. The industry made many representations to the government to appoint a drug regulatory authority, because that's what happens in countries like the United States, Europe. There is a drug regulatory authority, which is independent of any other government body, and is the responsibility of that authority to approve drugs, to monitor the quality of the drugs, to have drug inspectors go around and pick up samples and test it. But it wasn't until there was an episode in Lahore where a couple of 100 people died because of some problem with the drugs, that it dawned on them that there is a problem. So now in February of this year, the President passed the executive order to set up a drug regulatory authority. And it has come into being. But it has to be ratified by Parliament. And then they have to set up the necessary systems. The organization has to be put into place. So at the moment, I'm sorry to say, it's a bit of a limbo. Drug registrations are pending. Drug approvals are not achieved. But all I can say to you is that Pakistan is a place where you can do business if you can navigate. You have to navigate. You have to know how to navigate. It's not easy. Abbott Pakistan is a public limited company. We have about 2,700 shareholders. It's controlled 80% is by Abbott US. But we're making decent money. We make good money. In spite of all this, in spite of price controls, because our units volumes are huge. India, by the way, is the third largest producer of pharmaceuticals in the world, and Pakistan is the fifth. So, but when you look at the size of the market, in value, it's small. This 2 billion is nothing. But if you were to translate that and take the US pricing or the Singapore pricing, you're talking about a $20 billion market. It's a huge market. In units, we churn out a hell of a lot of units. So in conclusion, I just want to say that we've had a good experience in Pakistan because we've been lucky to have good management. Secondly, we've been able to navigate successfully. It's not easy. It's very difficult. But you can be successful. A lot depends on the environment. And as Mr. Berkey says, if the phase 3 scenario comes into place, then I think we have a great future. Thank you, ladies and gentlemen.